Hey, I'm Stephanie. I'm with 9 Health. Hopefully you can hear us now. We were having some technical issues with our Facebook Live. But this is Health Happens. It's our weekly Facebook Live show that we do every Tuesday. Today we're going to be talking about Medicare. We're with Levito Squalls, and he is an independent Medicare agent. So you can ask all the questions. We will get them all answered. All month long, we're focusing on insurance and the different insurance topics. Thanks to Connect for All for Colorado. I'll put a link to their website in the comments. They're a very good resource. They're the official health insurance marketplace for Coloradans, the place where you can get tax breaks, financial assistance to help pay for those insurance costs. But again, talking Medicare today.
Yep.
So Levito, thank you for joining us.
Thank you for having me.
First, tell us what Medicare is for those that don't know.
Okay. Well, I like to give a little history first on Medicare. Medicare started in 1965. It was signed into law by Lyndon Johnson, so it's part of the Great Society. So it's easy to remember, not that anyone will have any history tests on it, but 1965, and you have to be 65 to get Medicare.
Makes it easy to remember.
Yeah, it does make it easy to remember. So for the most part, that's it. Most people that are, most people have Medicare when they turn 65, they age in. You can actually sign up for it 3 months before. If you get Social Security,
Right.
you generally will be signed in to both Part A and Part B for Medicare. But there are some people that do get Medicare before the age of 65. People that have end-stage renal disease, which also is kidney failure,
Right.
almost immediately get in. And the other folks are anyone who's been diagnosed with ALS, Lou Gehrig's disease, are immediately in. The other group that Richard Nixon signed in to law in 1972 is anyone under the age of 65 who has a permanent disability.
Okay.
So that is, that really increased the number of people, obviously, who have access to Medicare, and so that's that by regulation is anyone who's been disabled for 24 consecutive months.
Okay.
So that's the key, 2 years.
Okay.
Okay.
And you kind of talked about it, but there are different types. I mean, you touched on one type, but there are different types of Medicare and different plans. Can you tell me a little bit about those?
Drives people crazy.
Because it is confusing.
It drives people crazy.
Again, if you have questions, post them in the feed. I'm with Levito Squalls. He's an independent Medicare agent. We're getting all your Medicare questions answered today.
Right.
So different types of Medicare.
Yeah. So original Medicare is Part A. No, we'll be clear here. Part A and Part B.
Okay.
That's
Together,
original Medicare.
Those are called original Medicare.
That's called original Medicare. That's that red, white, and blue card that you get when you turn 65.
Okay.
Remind me to tell you something about how those cards have changed over the last couple years. But Part A, the simplest way to go without going into a lot of detail is Part A is hospital, and I try to describe Part B as almost everything else.
Okay.
So you go to the doctor, you go to the clinic.
And hospital meaning inpatient.
Inpatient, yes, thank you. Inpatient, but it does not include long-term care. It does include rehab if you go into a facility.
Okay.
So that's part of it. Original Medicare, if you just have original Medicare, you pay 20%, and the federal government or Center for Medicare and Medicare Services, or Medicare.gov, not Medicare.gov, but Medicare, will pay the other 80%.
Okay.
The problem with that is that there's no cap on that. If you went into the hospital and you had a $100,000 bill,
Right.
you'd be on the tab for $20,000. Now, in 1997, there were some iterations of this before, but in 1997 is when Part C came in, and that's private Medicare. That's when companies like Anthem and Humana or Kaiser, a number of companies got into the business of offering Medicare private. And the way that works is that those companies partner with the federal government, and they take the risk. So if you decide to leave original Medicare and sign up with a private company, those companies get paid somewhere between $8,000 to $10,000 a year to take your risk.
Okay.
Now, if they have a good year, right, there's they make a lot of money. But if someone has illness or hospital, those bills go up, and it's worth it for the federal government overall. It's a good partnership. It's worth it for the federal government to have those carriers, and it's been obviously very lucrative for these insurance companies. So that's Part A, Part B.
So you either have A and B or C. Is that,
Yes.
did I understand that right?
Yeah,
Okay.
yeah. You have A and B
Or you choose
C.
to do C. Okay.
Choose to do C, and you can change that every year. And
Okay.
so we forgot to mention that open enrollment. So this is a great timing because open enrollment starts October 15th.
Yeah, it's November
And
1st for all traditional kind of
for
insurance plans,
but
earlier for Medicare.
But earlier for Medicare, you can start talking to people about their Medicare plans on October 1.
Okay.
But a broker or an agent cannot take any plans until October 15th. And if you send them in, they won't accept them. So wait until October 15th if you're signing up for a plan. Now I talked about Part A, Part B, Part C,
Right. Yes.
Now Part D.
Okay.
So Part D is prescription drugs plan. So that's a good way to remember. It's the drug plan. So Part D is just prescription
That's
drug
nice.
plan.
It'd be nice if the other letters correlated a little more.
It would be
They
nice.
do.
It would be nice.
Part
It would-
H.
So we've got those
Part
four.
H.
So yeah, Part A. So the thing that, and I want to spend a few minutes talking about Part D because that's
Sure.
the one that gives people the most angst and anxiety.
Okay.
Because everyone knows, or if you have an older parent or grandparent, whether you were listening or not, you remember the term donut hole. They go, oh, I'm in the donut hole. Well, the way that it works is that there are four stages to Part D. First is the deductible.
Okay.
It's without going into it, it's like $415 that
Okay.
once you pay that deductible, and there's some other things I won't go into that here, but once you pay the deductible, then you and the insurance company partner during the primary part of the prescription drugs. Then the third part is that dreaded donut hole. It's after something, so to not go really into a lot of detail, it's like $3,800. Once you spent $3,800, you drop into that donut hole until you reach $5,100.
So you just keep.
Yeah, so then you
reach
come out of
something
the,
and then you keep.
yeah, and it's the most expensive in the donut hole. So that's
Okay.
why they always talk about it. And
Okay.
most people don't reach the donut hole.
Okay.
But those that do are usually ones that are on multiple prescription drugs.
Right, and then this is until it's 100% covered?
Yeah, well, once you get to 5,100, then you pay 5%.
Okay.
So that's a lot.
Mostly covered, but yeah, that is a lot.
Yeah, it's a lot. Find a broker, find someone to explain it. Don't try to do this on your own.
Find someone like Levito as well. His information
or-
is in the comments.
Yeah.
He knows it all.
And it doesn't try, and so, and this isn't a commercial for me, but it doesn't cost anything. I think a lot of people,
Right.
they don't want a broker because they go, oh, it's, if I do it on my
That's
own,
good to
it's
know.
cheaper. It's not cheaper. It's the same price.
Right.
They bake any commission that your broker may get is already baked in. So if you don't
Okay.
use a broker, they just keep the insurance company just keeps the money. And generally, a good broker will save you money.
And saves you time.
Yeah,
Like
and
the cost of your time
Oh
is
yeah,
worth something.
and I think the important thing to remember is that don't let if you're not comfortable with just looking online, ask a neighbor or friend. I bet if you call 3 people, you'll find someone that's found a broker that they like, and will recommend them to you.
Okay.
Okay.
All right. I'm going to
So I
check
know,
and see if we have
that's
any
a lot.
questions
Okay.
going on. Again, if you have any questions, you can post them in the comments. I will get them answered by Levito, and if you think of one later, you can post it here as well. Tetanus is covered by Part D, not A or B. Your doctor may not tell you. Do you know anything about certain things that are covered? It can cost $25 to $1,000.
Part B. I'm guessing.
Okay.
I'm not guessing. It's an educated guess.
Yeah,
The
they were
part
saying that it's
that
covered
te-
by Part D, not A or B. So like they
Well,
had.
Well, Part D is
drug
drugs,
coverage,
right?
right.
So, but I'm glad that question came up because there are drugs that are covered in Part B.
Okay.
Anything that occurs in the hospital. If
Okay.
you get, I've got a client who's on a very specific drug, and it has to be administered by a doctor. So if it has to be administered by a doctor, chances are it's Part B. So if it's covered, it's less expensive. And those drugs are usually over $1,000. So if you get tetanus, it's a Part B event. It's
Okay.
not the drugs. So I don't think, and I don't know enough about tetanus, but I don't think that they give you that drug and then you administer it at home.
Right. it'd
So
be something
that's the
inpatient.
key. If it's administered in a facility and definitely in a hospital, it's Part B.
Okay.
Yeah.
Now, is it
I'm
Part
sorry.
A
I'm sorry.
hospital?
Part A. Yeah. I'm
Part
sorry.
A,
Yeah.
okay.
Part A. Yeah. So
Part B is like
yeah.
regular doctor
Yeah,
visits.
yeah.
Part A would be your
Yeah,
inpatient
yeah.
hospital care.
Yeah, but still the drugs are generally Part B, which is a
Okay.
little confusing.
So while we're talking about coverage, what isn't covered by Medicare?
What isn't covered? Generally, there are a number of things that aren't covered by. So we're talking about original Medicare.
Right. So original Medicare,
so
Part A, Part B.
Part B.
Because Part C,
Long-term
if you
care.
opt into that, would be more like traditional insurance.
Yep. Long-term care is not covered. No,
Okay.
long-term care is an additional insurance plan that you may want to buy. That business, that's a whole different day subject to talk about long-term care. Long-term care isn't eye care in most cases, dental. People here in Colorado, what's the thing? The chiropractors are not.
Oh,
in most,
right, okay.
in a lot of cases aren't. So sometimes they are, sometimes they're not.
Okay.
In Part B, I think, and but that's one of the reasons that you get Part C, because if you get Part C, a private company, and by the way, there are zero premium plans, so we don't call them free, and that's why people think.
Yeah, that's the next question. Is it free?
Yeah, if it with so two things. So remind me, come back to that.
Okay.
But we're just talking about Part C now.
Right.
There are zero premium plans that don't cost you anything additional. People don't like. Some people that don't know think, why would I want that plan?
Right.
But going back to what I was talking about, the carriers get $8,000 to $10,000 a year. That's why it's a zero premium plan.
Okay.
Original Medicare, so going back to that, most people get original Part A. They are entitled to Part A once they turn 65 because most people have paid into the system over the years.
Right.
When you're young like yourself, you look at those lines on your check and you see
Right.
that. So I don't know. It's you don't care. I didn't look at it either when I was young, and now I go, oh yeah, that's what I was
Right.
paying
That's
into.
what I was paying into.
Yeah. So most people will get Part A if you've worked 40 quarters over your life. I don't
Okay.
know why they don't say 10 years. But they say 40 quarters over your life. Part B, in most cases, you are entitled to it, but you have to pay for that. And
Okay.
this year, it's $135.50. Creeps up a
For
little
the
bit.
year?
For the year.
Okay.
Oh, no, I'm sorry, monthly.
Per month. Okay.
Monthly, yeah, thank you. So monthly, $135.50 for that. And
Okay.
so if you get those two, then if you get a private plan, through one of the companies, it's a zero premium plan, it'll say zero next to it, you don't have to pay anything additional. And then you get eye care in some cases, and then
Okay.
you get dental, and then you get,
Right. Because some of the things that are covered by.
what's the other thing, hearing aids,
Right.
which are huge.
Right.
So those are part of carriers. But believe it or not, I think there are like 30% of the people in the U.S. that just have original Medicare, and for no reason, because they just don't know.
Yeah. And it was
to
the
purchase
automatic
it.
thing they were put into, and
Yeah,
they're not
yeah.
getting coverage for some of the things they
Yeah,
need.
yeah, and they don't, and so the other part of that is some people don't add Part D, and if you don't add Part D, so two things: if you don't add Part B when you are eligible for it, there's a lifetime penalty. It's 10% for every 12 months.
Right.
that
Yeah. Because you're only automatically enrolled into Part A.
You're only automatically enrolled. Some people get upset about that, but that's why the system works, because everyone has to roll in,
Yeah.
and so then you've got this co-op of seniors
Right.
that are helping everyone pay for their plan. So you must purchase Part B, and if you don't, well, you don't have to.
Right.
But at some point when you need it,
But there's
you're
a
going to
certain
have this
window.
lifetime penalty.
What's
So
the window for purchasing Part B?
3 months.
Okay.
Yeah.
From when you stop working.
Yes.
Or whenever you need
Yeah.
it.
Yeah. No, I'm sorry. It's 6 months.
Okay.
6 months. So 6 months from that time. Now the key to that is, I guess, 10. So it's 10% for the rest of your life. So if it's so that Part B is $135 this year, that 10% would be another $13
Per month.
Per month. The other part of that is Part D. So this gets confusing. So Part D penalty. I know this is
it
just
is
drives
a lot of
people
it is
crazy.
confusing, which is
Yeah,
great.
and that's why you
Just
should.
someone
Yeah.
like Levito.
So Part D is 1%. I don't know why they aren't the same. I bet because it's different administrations when all these other issues come up. So Part D is 1% per month
Okay.
for the basic plan of that's offered each year. So the average price, I should say. So this year it's like $32.15. So
Okay.
1% for every month, and that doesn't. There's no cap on that. So
Okay.
if you haven't, same thing. If you've gone, so on that side it's 63 days. Again, why isn't the same? If you don't have prescription drug coverage or you're open for 63 days, you incur a penalty.
Right.
That's a lot.
Yeah, that is a lot.
That's a lot of information. That's a lot. Yeah, yeah.
So we kind of touched on this a little bit. Well, we haven't really touched on this one. I'm going to ask you, where can and someone did just ask this on Facebook. they just asked, is there a doctor's office that accepts Medicare? So where can people use Medicare? Are there specific doctor's offices?
Perfect.
Oh, yeah, and
we should go to this screen. Okay.
So let's
Visual
bring up
effect.
that resource.
Okay.
So Medicare.gov is a great resource to answer some of the questions.
So Medicare.gov, you can get a lot of answers on Medicare.gov. And you probably could sign up on Medicare.gov, but it's a little bit like working on your own car.
Right.
Like, why would you? I mean, there's no way that you're going to accumulate enough knowledge, especially if you have a short window to sign up, and not miss something. You should check. It doesn't, like I said, it doesn't cost anything. But so what was your? I'm sorry. So what was your question?
We brought this up when I had asked where can you use Medicare, what doctor's offices accept it.
So
this
you
would be a good resource.
Yeah,
to
so
find
you
that
go
info.
here and you can go down where it says find health and drug plans.
Okay.
And you click through there. I think that's where it is, and you can. Medicare plan, so up at the top. Yeah, so it asks for your zip code, but Medicare plan, find your home. I think that's where it is. It's in there somewhere. So anyway, once you can go in here, without going into details, you can go in here and find who takes original Medicare and who doesn't.
Okay.
Same way with a private plan. You go to their website, and you can go in and look for Physician Finder. There are thousands of doctors and places that take Medicare in the state of Colorado. So you won't have any problem finding a doctor. A lot of people. And there are some people that are that have a doctor. They generally don't take Medicare, but if you have a long relationship with your doctor, I find a lot of times they'll continue to keep you as their patient.
Okay.
Yeah. One other thing. So the last thing that at least that I wanted to mention about this whole alphabet soup is that now we talked about.
That's a good way to describe it. So when we're talking about Medicare, there's a lot of plans, A, B, C, D.
Parts. Now we're going to talk about plans, which is Medigap, supplements, Medigap. So you can have original Medicare, and then you can have a supplement. And when we generally think about supplements, we think accident supplement, but this supplements original Medicare. So it costs you a little bit more, but a lot of them cover everything. So they cover that 20%, everything. And a lot of them, there are a couple that you can pay a premium, generally around $100 or maybe $125.
Would this be more affordable than going to just Plan C?
No, because not necessarily. So when I'm sitting down with someone, I try to understand what their lifestyle are. Some people aren't traveling. Some people are on budgets. I think that they are best in a Part C plan.
Okay.
But if you're retired and if you've done very well in your career and you think you and your spouse are going to travel, I like a plan because it travels. So using that word, it travels everywhere. You can use it across the 50 states. And in addition to that, there's a portion of it that also pays for overseas, which original Medicare doesn't. So if you're overseas, you're like just out there on your own. Same way with a lot of the, almost all of the Part C plans. They work the same way that maybe your plan now. If something happens, it'll help you with emergency.
Right.
But there are some plans. So parts and plans.
Parts and plans. Yeah.
Parts
Part
and
C.
plans.
I said Plan C.
Now, in Medigap, they usually call it supplement and Medigap. It's the same thing.
Okay.
I don't know why they confuse people that way, but Medigap, supplement, same thing.
Okay.
Yeah.
All right, good to know. And we talked about the penalty. We did touch a little bit on is Medicare free, and someone is bringing up the zero premium plans on here.
Yeah.
So explain maybe that again,
Okay, so most companies will have a zero premium. So they'll have plans that cost maybe $25, $50, or $75 a month. But there's always an entry, HMO, and they're generally HMO plans.
Okay.
So those are zero premium plans, and they make that money. So going back to, one of the things I always ask my kids, or when we have questions, they would say, Dad, why did they do that? And I say, if you can't understand why they did it, it's usually because of money. And so that's a rule of thumb that they still do to this day. So if you can't understand why you would be available to have a zero premium plan, it's because of money, because they get paid that $8,000 to $10,000. So it's a great plan. It's an HMO plan, but it's a specific network that you can work in. And so there's a HMO plan and a PPO plan. If you've had those plans through your companies, I think you understand concepts of an HMO. Generally, I talk about it's like, okay, we're saying, okay, if someone has an HMO, think of it as a city, and then a PPO is like the state.
Right.
You know,
Okay.
so
That makes
or a
sense.
region. So you start. So a PPO plan has bigger, larger coverage than an HMO plan, and a supplement is like a plan on steroids, right?
Right.
It covers everywhere. As long as they take original Medicare, they have to take your supplement.
Okay.
But you also have to have a Part D with that. That's why I know it's a lot. You have to buy a prescription drug
The
plan
alphabet
with
soup
that.
was a good way to describe it.
Alphabet soup.
So it is confusing. There's lots to understand. We're going to sign off from here in a moment because
Oh, okay.
we've covered a lot. And if you have any questions, additional questions, post them in the comments. We'll get those answered by Levito. Is there anything else that you wanted to add that you think is a good point to drive home? We pulled up the Medicare.gov website. That's a great resource and website to look at.
Start early. Start early. I know some folks don't want to deal with this, or they
Right.
push it in the back of their head. Start early. Call. I've got some folks that will call me about 6 months out, and they've done their
Those prepared folks.
they've done their homework. They ask the questions, and they still use a broker, even though they have everything. And that way, you're not taken by surprise. And I think that's
Right.
it. And don't do it on your own.
Don't do it on your own because, again, it doesn't cost you anything to use someone like Levito, and it saves you time too.
It saves you time.
Help you
Yeah,
understand
we do
that
it all the
alphabet soup
time.
of
Yes,
Medicare. I love
exactly
that term
right.
you use. All right. Well, again, this is Help Happens. It's our show we do every Tuesday live on Facebook. This month we're talking all things insurance thanks to Connect for Health Colorado. I'll post their website also in the comments because they're a great resource and a great marketplace for Colorado insurance.